The ER at Harborview Memorial carried a steady hum at 1:38 a.m. Not loud, not dramatic, just constant. Fluorescent lights buzzed overhead. Rain streaked the ambulance bay glass in thin silver lines. Monitor tones rose and fell in measured rhythm, like a metronome no one noticed anymore. Emma Hayes stepped onto the unit 8 minutes before her shift officially began. She did not announce her arrival. She never did. Her badge still felt new against her scrub top. Probationary transfer sat in small letters beneath her name, as if the hospital needed to remind her she was temporary. She walked the unit once before logging in. The crash cart near Trauma 2 had a seal slightly torn. Paper-thin plastic lifting at one edge. Someone had resealed it in a hurry. Emma replaced it quietly, pressing the new tag flat and recording the time in small, clean handwriting. In Bay 5, a blood pressure cuff calibration drifted high by a few points. She reset it, tested it twice, returned it exactly as she found it. No announcement, no correction note directed at anyone. She adjusted oxygen flow on a hallway bed where a patient's cannula had slipped a few millimeters off center. She relabeled a medication syringe with clearer handwriting. She checked suction pressure in a trauma bay that, officially, she was not assigned to. No one noticed. At the central desk, Charge Nurse Benton scanned the staffing board with visible fatigue. "Hayes," she said without looking up, "you're on hallway beds and discharge paperwork tonight." Emma nodded once. "And stay out of trauma unless you're called. I don't need probationary surprises." "Yes," Emma replied, voice even. A resident nearby, Dr. Keller, 3rd year, leaned back in his chair and smirked. "That's good advice," he said lightly. "She triple-checks everything. Takes forever. We'd still be in triage by sunrise." A few nurses let out tired laughs. Emma kept her eyes on the chart in her hands. Her fingers did not tighten. Her shoulders did not shift. She absorbed it the way she absorbed most things, without surface reaction. In Bay 3, she adjusted a patient's IV tape where it had begun to peel. She checked the integrity of a saline lock with gentle pressure. She moved like someone conserving motion, not like someone unsure. Behind her, Keller's voice carried again. "Careful with those hands, Hayes. Don't want them shaking when something real comes in." Her hands were steady. They only trembled when watched too closely. As she returned to the nurse's station, her gaze drifted down the trauma corridor. The side security door, meant to remain magnetically sealed, was propped open with a folded supply list wedged into the frame. A shortcut for transport, a convenience. Emma stepped over, removed the paper and let the lock click closed. The sound was soft, final. The security guard glanced up from his monitor. "We keep that open for flow," he muttered. "It's supposed to close," Emma said. He shrugged. "This isn't a war zone." Emma did not respond. She walked back to the desk and entered a short note in the internal maintenance log. Trauma access door found unsecured at 0142. Secured. No commentary, just fact. A phone rang down the hall near the administrative offices, not the public line. A smaller, private ring. Emma wasn't listening for it. Her body just registered tone shifts. "He's inbound," a low male voice said, partially muffled by the corner wall. "Keep it quiet." A pause. "No press, no external notifications. Handle internally." Emma's pen paused for half a second above the chart. Inbound. Her chest tightened with a memory she did not invite. Rotor wash against wet pavement. Harsh white triage lights cutting through night fog. A stretcher descending too fast. Someone shouting vitals over engine noise. Her hands inside blood-soaked gloves that had not trembled then. She swallowed. The ER returned. Fluorescent hum. Chart paper. Rain on glass. She adjusted a cuff around a sleeping patient's arm, securing the Velcro so it would not startle him awake. At the desk, Keller glanced at the clock. Almost 2. Dead night. "Don't say that," a nurse muttered. Outside, faint at first, a siren threaded through the rain. It was distant, not urgent yet, but it carried differently than routine transport. Emma's eyes lifted toward the ambulance bay without turning her head. The air shifted, not louder, not chaotic, just charged. Charged. Nurse Benton straightened slightly, though she did not speak. Security glanced at the entrance monitors. The siren grew closer, then cut abruptly, replaced by the hiss of brakes on wet pavement. Emma closed the last chart in her stack and set it down neatly. Her breathing remained slow. Her posture remained neutral, but her awareness expanded, mapping exits, counting staff in immediate range, tracking who stood where. She did not move toward trauma. She waited to be called. The automatic doors slid open with a mechanical sigh. Rain gusted in briefly, carrying the smell of wet asphalt. Somewhere beyond the glass, a stretcher wheel hit the threshold hard enough to rattle, and before anyone said it aloud, before any announcement was made, the ER felt different. Wrong quiet. Emma reached for a fresh pair of gloves and slid them on with controlled precision. Her hands did not shake now. They never did when something real was coming. The ambulance doors opened without sirens. That was the first detail Emma registered. No lights spinning against the rain, no chaotic shouting, just a controlled arrival, measured steps, stretcher wheels guided, not rushed. 2 paramedics rolled in, an adult male labeled only as unknown. Mid-40s, broad shoulders, civilian clothes cut cleanly at the seams for access, a small smear of dried blood at the collar. "Found after an off-site incident," one paramedic said. The tone was flat, non-committal. "What kind of incident?" Dr. Keller asked, already snapping on gloves. "Unknown." It was the kind of answer that closed doors instead of opening them. Emma stepped closer, but stayed just outside the primary circle. She watched the rhythm of movement before the words. Vitals were called out. BP 130/80, heart rate 72, O2 98 on room air. Stable. Too stable. The chart note on the stretcher mentioned possible ambush, suspected blunt trauma, brief loss of consciousness. But his numbers did not match someone pulled from chaos minutes ago. His breathing was even, not shallow, not erratic, even. Security positioned themselves near the trauma bay entrance, but not aggressively. One guard whispered into a radio as if this were a routine VIP intake. Doctors focused on scans. "CT head and neck, full trauma panel," Keller ordered. "Let's move." Emma stepped in to assist with lead placement. The man lay motionless, eyes closed, jaw relaxed. But the stillness did not feel natural. His boots were clean, not polished, just clean. No wet mud tracked across the soles despite the rain outside. She noted it without changing her expression. A paramedic peeled back a sleeve to reveal an IV line already placed. The tape was cut in sharp angles, layered precisely to allow flexion without pull, secured in a way that anticipated movement. That was not a rushed civilian placement. Emma adjusted the cardiac leads on his chest. His skin was warm, not clammy, not cooling from exposure. "Possible head injury," Keller said. "Could be internal bleed. We'll confirm." Emma's eyes flicked to the monitor again. Heart rate steady. Respirations consistent at 14 per minute, not irregular, not compensating, controlled. She leaned closer to position the pulse oximeter correctly. The patient's breathing did not change when she invaded his personal space. No startle reflex, no tension, just steady, timed inhalations. It looked practiced. "Haze," Keller said without looking at her. "Just chart what you see. Don't interpret." "Yes," she answered softly. Security stepped in briefly, scanning the room. "Is this classified?" One guard asked no one in particular. "It's medical," Keller replied sharply. "That's what it is." Emma's attention shifted to the patient's hands. They lay open at his sides, fingers relaxed. Too relaxed. She reached down to check capillary refill. Her thumb pressed gently against the nail bed. Color returned quickly. Healthy perfusion. As she moved his right hand slightly to place a lead, she felt it. Callous, not random. A thickened band along the index finger's distal pad, a second ridge along the thumb webbing, repeated friction, consistent pressure over time, trigger conditioning. She did not look up. She placed the lead exactly where it needed to be. "Any ID?" Keller asked the paramedic. "Nothing usable. Wallet was removed by someone before we got there." Removed, not lost. Emma leaned in to adjust the blood pressure cuff. As she did, she noticed something else. The man's breathing pattern shifted when Keller's voice rose slightly, not visibly, but on the monitor the heart rate ticked up 2 beats per minute, then settled, listening. Emma kept her face neutral. The team moved quickly toward imaging prep. "Let's sedate lightly before transport," Keller said, "just in case he wakes disoriented." "He's not combative," Emma said quietly. Keller glanced at her. "You want to wait until he is?" She lowered her eyes again. "No." Security hovered closer now, not protective, observational. One guard stepped outside to make another phone call. Emma reached across the bed to reposition the patient slightly for transport. As she did, she angled his head a few degrees, not enough for anyone to question, just enough to change what he could see if his eyes opened even a fraction. The overhead lights reflected faintly in the polished cabinet doors opposite the bed, a mirror of the room. "Hayes," Keller snapped, "you're crowding." "I'm done," she said. She stepped back, but before she did, she spoke softly, low enough that only someone inches away would hear. "Your airway is clear, neutral, clinical." The heart rate shifted again, 1 beat, then steady. Emma walked back toward the charting station. Her mind moved faster than her hands ever did. Stable vitals inconsistent with reported trauma, controlled breathing, military IV placement, trigger hand conditioning. Someone found after an incident with no documentation. Security acting too calm, and a private call earlier, "He's inbound. Keep it quiet." She did not look back at him again. She did not need to. She had seen enough. And when she resumed charting, her notes were precise, limited and careful, because if he was pretending, then it was not for drama. It was for survival. The trauma bay settled into routine efficiency, monitors steady, IV fluids running, orders placed, imaging cued. Dr. Keller stood at the bedside, pressing his knuckles hard into the patient's sternum. "No response to pain stimulus," he announced. He increased the pressure slightly, enough to leave a mark. "Nothing." "See?" Keller said, stepping back. "Unresponsive." The word moved through the room like a permission slip. Nurses adjusted settings. Security relaxed fractionally. The assumptions settled in place. Emma stood at the monitor, eyes on the numbers, not the declaration. Unresponsive. It was a convenient word. It closed questions. She stepped closer under the pretense of adjusting the blood pressure cuff. "Checking pupils," she said softly. Keller waved a dismissive hand. "They're fixed enough. CT will tell us more." Emma did not argue. She leaned in with her penlight anyway. The pupils were reactive, slightly delayed, but reactive. She waited a full second longer than protocol required before switching eyes. Tiny constriction, too controlled. She set the penlight down and checked his jaw tone as if adjusting the oxygen mask. Not rigid, not fully relaxed either. There was tension held in reserve. She placed her fingers lightly at the base of his throat to assess swallow reflex. There. Subtle. A coordinated muscle response, not random, not reflexive, timed. Emma stepped back half a pace. The room noise shifted as a stretcher rolled past the trauma corridor outside. Wheels rattled over a metal threshold. The patient's left index finger twitched. Once, then still. Emma's eyes flicked to the door. She replayed it in her mind. Footstep, metal rattle, micro flinch, timed, not to pain, to movement. Keller was already discussing scan priorities with radiology. "Let's expedite head CT. Possible closed head injury. Stable for now. Stable. Emma leaned in again, adjusting a lead that did not need adjusting. She lowered her voice to a level barely above breath. "You're in Harborview," she said, clinically neutral. "Night shift." No emotion, no signal words. On the monitor the heart rate moved, 72 to 76, then back down. Not panic, recognition. Emma's chest tightened once, then steadied. He's listening, not drifting, tracking. She kept her face neutral. She made no sudden movement. If he was pretending, it was deliberate, controlled. And if he was pretending, it meant he believed there was a reason, that someone might still be coming. She straightened and resumed charting. "Haze," Keller said without looking at her, "logged no response to stimulus." "Yes," she answered. She typed exactly what was observed. No gross motor response to applied sternal pressure. She did not add assumptions. She did not add conclusions. Security shifted near the doorway again. One guard leaned in, scanning the patient's face as if memorizing it. The patient's breathing remained steady, too steady. Not the shallow, irregular pattern of head trauma. Even. Counted. Emma stepped to the side of the bed and adjusted the wheel lock. "Bed's too close to the cabinet," she said lightly. No one objected. She unlocked the wheels, shifted the bed 2 feet to the left, and relocked it. The movement seemed practical. It was not. From this angle, if his eyes opened even a millimeter, he would see the reflection of the doorway in the glossy cabinet doors opposite. Line of sight. Without turning his head. Emma smoothed the blanket across his chest. Her hands brushed his wrist lightly. She felt the tension there again, not limp, held, ready. She leaned closer as if checking his IV site. "Airway clear," she murmured again, almost routine. The heart rate ticked up by 3 beats this time, then steadied. He heard her. He understood. Keller returned to the bedside. "Let's get sedation ready before transport. I don't want surprises." Emma's gaze dropped briefly. Sedation would remove his control, remove his awareness. If he was staying under on purpose, that would end it. "Vitals are stable," she said quietly. "We could wait until after imaging." Keller gave her a sharp look. "You're not in charge of that decision." She lowered her eyes again. "I know." She did not push further. "Shh, not yet." Her hands trembled slightly when she stepped away. Not fear, restraint. The tremor faded as soon as she touched the medication tray. In her peripheral vision, she saw it again. A faint shift in the patient's eyelid. Not enough for anyone else to notice. Enough for her. He was not unconscious. He was calculating, counting footsteps, tracking positions, listening for the wrong voice. Emma returned to her station and kept her movements slow, careful, exactly as expected of a probationary nurse who was too careful. She let the resident own the room. She let security believe they were in control. She did not reveal what she had seen. Because if someone was planning to come through that door, the worst thing she could do was expose him too early. The monitors continued their steady rhythm. 74, 73, 14 respirations per minute. The fluorescent hum carried on. And beneath it, in the quiet space no one else noticed, a silent exchange had already begun. The room felt tighter now. Not chaotic, not loud, just compressed, like air pressure building before a storm breaks. Dr. Keller returned from the radiology call with impatience in his stride. "We're sedating before transport," he said. "Light dose. I don't want him waking mid-scan." A nurse reached for the medication tray. Emma's eyes lifted, steady. "Vitals are stable," she said quietly. "Sedation could mask evolving neurosigns." Keller didn't look at her at first. He was already reviewing the chart. "It's precautionary." "If he's compensating for a head injury," she continued, careful with her words, "sedation could complicate airway management if we misread tone." The room shifted. A few glances moved toward her. Keller finally looked up. "You're probationary," he said evenly. "You don't override sedation decisions." "I'm not overriding," Emma replied, "just noting risk." His jaw tightened. "Do your job, Hayes. Chart. Leave the medicine to me." A few staff members lowered their eyes. The message was clear. Emma felt the heat rise along her neck. She let it pass. "Yes, doctor." She stepped back. Outward compliance. Inside, calculation. Sedation would remove his ability to track, remove his agency. If he was faking unresponsiveness for a reason, sedation would expose him, or worse, make him vulnerable. She moved to the medication cart. "Double-checking dosage per weight," she said calmly. "Standard procedure, legitimate." She scanned the order again. Weight estimated. No confirmed labs yet. She requested verification from pharmacy. "Just to confirm dilution," she added. Keller exhaled sharply but did not stop her. The order was routine enough that delay did not look like defiance. Emma's hands were steady as she keyed in the request. She bought time. Behind her, security murmured into radios. One guard stepped out briefly, glancing at his screen before returning. Emma caught the movement in peripheral vision. The trauma access monitor above the desk flickered as a log notification appeared. Badge swipe recorded. 0159, access point, trauma side corridor, authorized personnel, maintenance. Emma's gaze held on the timestamp a fraction too long. Maintenance, at 2 in the morning, in the middle of an unknown incident arrival. She turned her head slightly toward the charge nurse. "Maintenance request tonight?" she asked softly. The charge nurse frowned at the screen. "Not that I know of." Admin stepped into the corridor at that moment. Tie loosened, expression irritated at being awake. "What's the holdup?" he demanded. "Maintenance badge near trauma," Emma said, keeping her tone neutral. "Is that scheduled?" Admin barely glanced at the log. "Routine. Don't chase ghosts." "It was during patient intake," she replied. Admin's eyes narrowed. "It's maintenance." He moved on. Emma did not argue, but she memorized the timestamp. The patient's breathing remained even. Too even. Keller re-entered the room, checking his watch. "Pharmacy cleared?" he asked. "Verifying dilution," Emma answered. He stared at her for a second too long. "Move." She nodded. As she approached the bed again, she leaned in to check the IV port. Her hand brushed his wrist. Still tension there. Controlled. Waiting. The trauma corridor door clicked faintly as someone passed outside. The patient's right index finger moved, not a twitch. A tap, once, against the mattress. Small, precise. Emma did not look down immediately. She adjusted the IV tape instead. Tap. A warning. Her mind replayed the badge swipe. Unauthorized access near trauma. Maintenance. During intake. Someone had entered through a secured corridor. She kept her voice low as she checked his airway again. "Transport delayed," she murmured, clinically neutral. On the monitor, the heart rate shifted. 2 beats up, then steady. He understood. Keller reached for the syringe. "We're done waiting." Emma stepped slightly aside. "Vitals remain stable," she said softly. "I'm aware." He prepared the injection. Security shifted closer to the door again. Emma's eyes flicked to the reflective cabinet surface. A shadow moved in the corridor behind them. Not maintenance. Posture too upright. Hands empty. Watching. Emma exhaled slowly. Her delay bought minutes. Minutes mattered. She positioned herself on the opposite side of the bed. If sedation happened, she would be there to manage airway. If someone entered, she would see the reflection first. Her hands trembled briefly as she steadied the oxygen mask. Not fear, containment. Keller glanced at her again. "Relax." "I am," she replied. The syringe hovered near the IV port, and from the mattress, tap. Once more, clear, intentional. Emma's jaw tightened a fraction. He was ready for something, And someone had already made the first mistake. The badge swipe, the wrong timing, the wrong presence in a secured corridor. Sedation would remove his advantage. She let Keller proceed, because stopping him now would expose too much. But she adjusted the oxygen flow slightly, anticipating change. The fluorescent lights hummed. Rain hit the glass harder, and beneath the surface calm of the ER, the pattern was forming. Someone had entered the building quietly. Someone was moving through a corridor that should have been empty. And the man on the bed, still, controlled, eyes closed, was not asleep. He was waiting. The sedation order was prepared but not yet pushed. Keller paused to confirm imaging readiness. A small administrative delay. Another narrow window. Emma used it. She stepped to the bedside under the pretense of adjusting the blanket. Her movements were ordinary, slow, non-threatening. But her attention narrowed. His right hand rested palm down against the mattress. Not relaxed, not curled naturally, held. The tendons along the wrist were engaged. Slight flexion in the fingers, not enough for anyone scanning casually to question it. Enough for someone trained to recognize control, deliberate positioning, not unconscious sprawl. Emma let the blanket drape across his forearm, casual, protective, shielding the hand from obvious view. Her fingers brushed the inside of his wrist. No medical alert bracelet, no ID band beyond the temporary ER tag, but something else pressed against her knuckles, firm, circular, sewn into the seam of his undershirt near the ribline. She shifted the blanket slightly higher, pretending to smooth it. Her fingertips traced the edge, metal, thin, embedded discreetly in fabric, not decorative, functional concealment. Emma adjusted the fabric just enough to see the edge. A unit coin, not worn externally, sewn inside, flush with the lining, a hidden identifier. She recognized the edge pattern immediately. Serrated rim, matte finish, faint engraving she did not need to read fully. Naval Special Warfare, specific unit, not public. Her pulse did not change. Her face did not register recognition. But her breathing deepened once. He was not pretending randomly. He was preserving something. She let the fabric fall back into place and tucked the blanket more securely. Across the room, Keller spoke into his phone about CT availability. Security shifted positions again. Emma walked back to the central computer station. She pulled up the patient's chart. Current classification, unidentified trauma, standard access. She changed it quietly. Category, sensitive, restricted access. Justification, pending ID verification and security review. No dramatic wording, no red flags. Just a procedural adjustment that required supervisor-level sign-in to access full records. It would slow anyone without proper clearance. It would log every entry. She saved the note. Behind her, one of the nurses, Marisol, leaned closer. "Why are you switching categories?" she whispered. Emma kept typing. "Precaution." "For what?" Emma's eyes flicked toward the trauma corridor camera feed. "Because someone is coming." Marisol frowned. "Security already here." "Not them," Emma replied softly. She stood and moved back to the bed. "Let's swap this monitor," she said casually. "Leads glitching." It wasn't. But the portable unit near the far wall had better camera coverage from above. Clear angle of the doorway, clear line toward the locked corridor she had sealed earlier. She unlocked the bed wheels again, shifted it another foot. Small movements, incremental. Now the reflective cabinet surface captured the corridor fully. If his eyelids opened even a sliver, he would see anyone entering before they crossed the threshold. Emma resecured the wheels, adjusted the oxygen mask, rechecked pulse. The heart rate remained steady, 75, 76, then back to 74. The sedation syringe still rested on the tray. Keller turned back toward them. "Imaging ready in 5. Emma nodded. She leaned close to check the IV line once more. Her voice remained clinical, pressure stable. She lowered her tone further. "Access restricted." A beat of silence. The monitor flickered 1 beat higher. His left eyelid fluttered, so faint it could be dismissed as reflex. Emma did not look at it directly, but she saw it. Confirmation. He understood that something had changed, understood that she had seen the coin, understood that she had adjusted the environment. Security radios crackled faintly outside. "Unit 3 in corridor," a voice murmured. Emma's attention sharpened. The corridor camera feed showed a shadow pause near the trauma access door. Someone testing proximity, but the door remained sealed. She had removed the paper earlier. The shadow moved away. Emma exhaled slowly. Inside the room, nothing appeared different. Fluorescent hum, rain on glass, monitors steady. Marisol stepped closer again. "Haze," she whispered. "This is bigger than us." Emma didn't look at her. "I know. Then why are you the only one acting like it?" Emma adjusted the blanket one last time. "Because if I say it out loud," she said quietly, "it changes everything." She stepped back to her station. Keller approached with the syringe. "Ready?" Emma positioned herself near the head of the bed. If sedation was administered, she would manage airway. If something moved through that door, she would see it first. The patient remained motionless, but beneath the blanket, tension held, waiting, listening, tracking. Emma's hands were steady now, not trembling. Calm had replaced doubt. The coin edge beneath fabric confirmed what her instincts already knew. This was not an accident victim, not random violence. This was a controlled survivor inside a controlled body, and somewhere beyond the fluorescent light, someone was adjusting their approach. Emma kept her voice neutral. Airway clear. The eyelid fluttered again, almost imperceptible, but not random. Signal received. She did not smile. She did not react. She simply stood ready, while the noise of the ER continued to mask the signal moving underneath it. The call came through the internal line, not the public channel. Charge Nurse Benton picked it up, listened for 3 seconds, and her expression shifted from irritation to something tighter. She covered the receiver and looked toward security. "Possible security incident," she said quietly. "Do not announce." The words moved across the room without volume, but everyone heard them. No alarms, no overhead pages, just subtle movement. Security guards adjusted positions. One reached for the door control panel behind the nurse's station. Another stepped toward the trauma corridor. "Lock it down quietly," Benton instructed. The magnetic locks clicked in sequence. 1, 2, 3. A soft, mechanical finality. On the wall monitor, the door status indicators shifted from green to red. Except one. Trauma side access, still green. Security frowned. "That's not right." He tapped the control panel again. Nothing changed. The log refreshed. Override authorized. Badge number unknown. Emma felt the weight settle in her stomach. Someone inside, not forcing entry, using access. The trauma corridor door opened without urgency. A man stepped through. Plain clothes, dark jacket, clean lines, confident stride, not rushed. He carried no visible weapon, no hospital badge, no clipboard, authority without proof. "I'm here for the patient," he said evenly. "Transfer authorization." Keller stepped forward immediately. "Yes, we were just preparing for imaging." The man's eyes moved across the room quickly, not scanning for medical cues, scanning for people. "Ambulance en route," he said. "He's coming with me." "No paperwork?" Benton asked carefully. "Federal matter," he replied. Emma watched his posture. Wrong center of gravity, too upright for someone accustomed to hospital flow. His eyes lingered on the door controls instead of the monitors. He did not look at the IV pumps. He did not look at the oxygen flow. He did not look at the patient. He looked at exits. Keller nodded quickly. Understood. Emma stepped closer to the bedside, placing herself between the man and the IV lines without making it obvious. "ID verification?" she asked quietly. The man glanced at her as if noticing her for the first time. Already handled. Chain of custody documentation, she continued, voice calm. Not necessary. It is for transfer, Emma said. Attending sign-off required. His jaw tightened slightly. Time sensitive. Emma did not raise her voice. We still need ID verification and attending signature. Her tone was professional, not confrontational. The room grew still. Security shifted uneasily. The man stepped closer to the bed, close enough that Emma could see faint irritation beneath the calm. You're delaying a federal directive, he said softly. I'm preventing a liability issue, she replied. Keller cleared his throat. Hayes, that's enough. The man turned to Keller. Are you in charge here? For the moment, Keller answered. Then we're done waiting. Emma's eyes flicked to the monitor. Heart rate 74. Steady. The man reached toward the bed rail. The patient's breathing shifted. Barely. Respirations deepened by half a beat, then slowed, controlled, not startled. Ready. Emma saw it, the change that only someone watching breath patterns would notice. The man placed his hand on the rail. Let's move. Emma stepped slightly to adjust the wheel lock, subtle, blocking forward momentum. We need imaging clearance first, she said. He leaned closer to her. You're out of your depth. She held his gaze. Probably. Her voice did not rise, but protocol applies to everyone. He smiled faintly, not warm. You don't understand what you're interfering with. Emma's hands trembled briefly against the rail. Restraint, not fear. I understand hospital procedure, she said. Behind them, security murmured into radios again. Control panel override confirmed, one guard whispered. No internal authorization. The man's eyes flicked toward the sound, just for a second. He recalibrated. I don't have time for this, he said, stepping around Emma toward the head of the bed. Wrong move. He moved toward the airway without checking lines, without acknowledging sedation prep, without asking about cervical stability. No medical authority, just intent. Emma placed her hand lightly on the oxygen mask. If we move him without securing lines, she said calmly, he destabilizes. The man's tone hardened. Step aside. Behind the closed eyelids, the patient's jaw tightened almost imperceptibly. The monitor ticked up 2 beats, then settled. He was no longer conserving energy, he was measuring. Emma's voice lowered further. Airway stable. Neutral words. For him. The man's gaze snapped to her face. He noticed the cadence, but he did not understand it. Last warning, he said quietly. Emma did not move. Security stepped closer, uncertain which authority to obey. The trauma corridor camera feed flickered again. Another shadow moved near the locked door. Not alone. The room held its breath. Fluorescent lights hummed overhead, rain pressed against the glass. The man reached for the bed wheel again, and the patient's breathing shifted once more. Still unresponsive, but poised. The hospital had locked from the inside, but someone had already crossed the wrong threshold, and Emma knew, without needing proof, that this was not a transfer. It was extraction, and she was the only one in the room who understood the difference. The room did not explode into chaos. It narrowed. That was worse. The plainclothes man still stood near the bed rail, close enough to act, close enough to force motion. Emma stepped back from him without yielding ground and turned toward charge nurse Benton. Can I speak with you? She said quietly. Benton's jaw was tight. Make it quick. They stepped 3 feet away, still within sight of the bed. He doesn't have proper credentials, Emma said. Badge override logged, trauma corridor. Benton's eyes flicked toward the door, then back to Emma. It's federal, she whispered. We don't interfere with that. We do if it's not verified, Emma replied. Benton's expression hardened. Don't create drama, Hayes. You're on probation. Emma absorbed the word without flinching. I'm not creating drama, she said softly. I'm flagging risk. Benton looked past her to the man waiting at the bedside. This isn't your call. Emma nodded once. I know. She stepped away before Benton could dismiss her further. Instead of arguing upward, she pivoted sideways. She picked up the internal security phone and dialed directly. This is Nurse Hayes in Trauma 2, she said calmly. Confirming override badge ID at 0159. Please verify maintenance authorization. Silence on the other end. Then confusion. Maintenance? We don't have anyone logged in trauma tonight. Emma kept her voice neutral. Then who opened the corridor? We're short 2 officers, the voice replied. We're checking. Mixed orders, understaffed, fragmented command. Emma hung up and returned to the bedside. Dr. Keller stepped in front of her. You are not escalating this, he said under his breath. I requested verification, she replied. You're insubordinate. I'm documenting. Keller's face reddened slightly. I can write you up for interfering with a federal directive. Emma met his eyes for a full second. I'm not refusing care, she said evenly. I'm preventing a mistake. The plainclothes man watched the exchange without speaking, calculating. Then he smiled faintly and addressed Emma directly. Let's step into the hallway, he said. You and I. No raised voice, no threat, just quiet pressure. Emma felt the pattern instantly. Isolation. Remove the barrier. Control the narrative. She shook her head once. I need to remain with my patient. He tilted his head. You're not his primary. I'm assigned to this bay. A half-truth, but defensible. He took one step closer. Come into the hall. Her hands trembled. Not fear, recognition. She had seen this before. Not in a hospital, in other corridors, in rooms where authority was used as a tool. She kept her hands visible, resting lightly on the bedrail. If you need something, she said calmly, we can speak here. His jaw tightened. Security hovered near the doorway but did not intervene. Confusion made everyone slower. Emma's peripheral vision tracked the reflective cabinet surface again. Another shadow passed behind the trauma corridor glass. Not maintenance. 2 silhouettes now. The patient's breathing deepened again. Measured. He was preparing. The plainclothes man reached toward the bedwheel. Emma shifted her foot slightly. Subtle. Blocking leverage. Transport requires documentation, she repeated. He lowered his voice further. You don't know what you're interfering with. Emma's pulse ticked higher. Her hands trembled again. Restraint, because she did know the pattern. Unknown extraction. Internal override. Pressure applied through isolation. Then show ID, she said quietly. He did not. Instead, he leaned closer. You're going to regret this. The words were soft. No witnesses would hear them clearly. Emma did not step back. I'm still waiting on verification. Behind them, security's radio crackled. Control confirms no maintenance badge assigned to trauma corridor. The words were faint, but they carried. The plainclothes man's posture shifted, just slightly. A recalibration. Dr. Keller looked between them. What is going on? He demanded. Emma did not answer him. Her focus stayed on the man, on his hands, on his positioning relative to the bed. The patient's heart rate ticked up by 2 beats, then settled. Ready. Emma's voice dropped almost to a whisper. Airway stable. Neutral. Clinical. The man's eyes flicked to the monitor. He noticed the numbers. He noticed her calm. He realized she was not reacting emotionally. She was reading him. He took a step back, not retreating, reassessing. Benton moved closer now, uncertainty finally outweighing dismissal. What's the status? She asked security. Override unverified, came the reply. The room held its breath again. Emma felt the tremor in her fingers intensify briefly. She clasped them together to still it, restraint, because if she raised her voice now, if she escalated too visibly, she would lose the room. Instead, she stood, visible, between the bed and the man. Calm. The cost of speaking up was already forming. Write-up, probation review, administrative consequences. But the pattern was clear. This was not routine. And if she stepped into that hallway alone, the structure would collapse around her. The man looked toward the corridor again. His timing was slipping. He had expected compliance. He had expected deference. Instead, he found friction. The patient's finger moved once under the blanket. Tap. Emma did not look down. She didn't need to. The room was still, but the setup was unraveling, and she was the only one holding the thread in place. The room did not explode. It tightened. The plainclothes man glanced once toward the trauma corridor, calculating the window he had left. Then he made a decision. He reached for the bed rail and pushed. The wheels rolled an inch before Emma's foot slid forward, resting lightly against the lock housing. Not forceful, not aggressive, just enough to prevent momentum. "Bed still secured," she said evenly. The man looked down at her foot, then at her face. "You're obstructing a federal transfer." "I'm preventing line displacement," she replied. The oxygen tubing was visibly looped around the rail, an ordinary clinical fact. The tension in the room rose like a silent alarm. Security stepped closer, but did not intervene. Dr. Keller opened his mouth to speak. Emma did not give him time. She leaned slightly toward the patient's ear, adjusting the oxygen mask as if checking fit. Her voice dropped to the lowest possible volume. "Blue corridor. 2 left." To anyone else, it sounded like she was noting hallway directions for transport. To him, it was orientation. His breathing changed, not erratic, intentional. A slight intake through the nose, then controlled exhale. The plainclothes man tried again to shift the bed, harder this time. Emma's foot did not move. She kept her eyes level. "Airway intact," she said softly. The patient's eyelids fluttered, then opened, slowly, not dramatic, not violent. He did not sit up. He did not lunge. He inhaled as if surfacing from deep water, eyes unfocused for a fraction of a second, then sharp. The room froze. Keller stepped back instinctively. "You're awake," he blurted. The man in plain clothes reacted first. "You shouldn't be moving," he said sharply. Wrong tone, wrong urgency. The patient's gaze shifted toward the voice, measured, assessing. The plainclothes man moved closer to the head of the bed. "Commander Hale," he said quickly, too quickly. "You're secure. We're extracting you." Wrong name. Emma saw it in the patient's eyes before anything else changed. A flicker. Cold. Assessment recalibrated. The man had guessed. He did not know. The patient's voice, when it came, was hoarse and controlled. "Extraction," he repeated faintly. The plainclothes man nodded once. "Yes. Immediate transfer." No unit identifier, no call sign, no verification phrase, nothing. The patient's breathing remained slow. "Who authorized?" he asked. A simple question. The man hesitated half a second. Too long. "Naval Command," he answered. "Which one?" He did not say. The mistake widened. Emma stepped back slightly, removing her foot from the wheel now that the bed was stable. She shifted her tone. "Patient responsive," she announced calmly. "Neuro intact. Maintain airway and monitor vitals." Clinical language, neutral, grounding the room in procedure. Security exchanged uncertain glances. The patient's eyes moved toward Emma. Recognition, not of identity, of competence. She did not nod. She did not smile. She simply held eye contact long enough for him to register stability. Then she turned to the staff. "Clear the corridor," she said. "Non-essential personnel out. Maintain sterile space." No shouting. No panic. Marisol moved immediately to close the outer curtain. Benton repositioned herself near the nurse's station phone. Keller stepped aside, confusion overtaking authority. The plainclothes man tried again. "Commander, we need to move now." The patient's eyes never left Emma. "What's your name?" he asked her quietly. "Hayes," she replied. "Rank?" "None here," she answered. A fraction of a second. Understanding passed. The plainclothes man reached toward the IV line. "Enough," he said. Emma's voice remained steady. "Do not touch the line. You are not credentialed for this bay." Security finally stepped forward. "Sir, we need identification," one guard said. The plainclothes man's jaw tightened. "You're interfering with federal operations." "Then show federal credentials," Benton replied, finding her footing. The patient shifted his weight slightly, weak, believable. He did not spring upright, he did not overpower anyone. He simply adjusted his shoulders, testing range of motion. The oxygen mask slipped slightly. Emma corrected it gently. "Vitals stable," she said. "Do not escalate." To the room, to him. The plainclothes man's composure cracked. "You don't understand what's coming," he muttered. The patient's eyes hardened. "Oh," he said quietly, "I do." Silence settled. The corridor outside filled with heavier footsteps now, coordinated, official, different cadence. The plainclothes man heard it too. He stepped back half a pace, calculating exit. Too late. Emma shifted her stance, placing herself slightly off to the side of the bed now, giving the patient line of sight to the door without obstruction. "Maintain positions," she said calmly. "No sudden movement." Her hands no longer trembled. They were steady, because the pattern had broken. The wrong man had spoken the wrong name, the wrong urgency, the wrong authority, and the patient, no longer pretending, had confirmed what she already knew. This was not extraction, it was exposure. The ER had transformed, not into chaos, into controlled ground. And Emma, still in her probationary badge, had turned a fluorescent trauma bay into a defensive perimeter without raising her voice once. The footsteps in the corridor were different, heavier, coordinated, not rushed, but decisive. The trauma door opened again, this time with a visible badge scan, green light flashing before the lock disengaged. 2 uniformed Naval Criminal Investigative Service agents entered first. Dark jackets, visible credentials, clipped movements. Behind them, a senior naval officer in medical insignia stepped in with a folder tucked under his arm. No raised voices, no dramatic entry, just paperwork. "Lieutenant Commander Hale," the senior officer said clearly, using the correct name and rank without hesitation. "You are secure." The room shifted instantly. The plainclothes man stepped back, recalculating too late. One of the agents turned toward him. "Identification," the agent said evenly. The man hesitated. "Just long enough." "Now," the agent repeated. He reached into his jacket. No weapon, no badge, just a laminated card that did not match the credentials format required. The agent took it without expression. "This is not authorized for federal extraction," he said calmly. The second agent stepped behind the man without touching him at first. "Sir, you will accompany us." No struggle, no dramatic resistance. The trap was procedural, not physical. The override log, the badge swipe, the lack of proper chain of custody documentation. Everything Emma had delayed and documented created a paper trail. The man looked once toward the patient. The patient met his gaze, cold, measured, no anger, no words, just confirmation that the deception had failed. The agents escorted the false official out of the trauma bay without force. The door sealed behind them with a soft, magnetic click. Silence settled. Dr. Keller stared at Emma. His face had drained of color. "You knew," he said quietly. Emma did not answer. She was adjusting the IV line, checking the oxygen flow, grounding the moment in routine. The naval medical officer stepped closer to the bedside. "Vitals?" he asked. "Stable," Emma replied. "Airway secure?" "Yes." He nodded once. "Professional recognition. Nothing more." The commander shifted slightly against the pillow, weakness still visible but no longer staged. His eyes found Emma again. "You moved the bed," he said softly. It was not a question. Emma's expression remained neutral. "For visibility," she replied. He gave the smallest nod. "Good call." Dr. Keller exhaled sharply, shame surfacing in the space where authority had been. "I should have verified credentials," he admitted. The naval officer glanced at him. "Yes," he said simply. The single word carried weight without accusation. Keller looked at Emma again. "I dismissed you." She did not look up from the monitor. "Patient stable," she repeated. The commander's gaze stayed on her. "Hayes," he said quietly. She met his eyes this time. "You were counting steps," she said. He almost smiled. "And you were reading reflections." A pause. Recognition without exposure. No rank spoken loudly. No past revealed. Just shared language. The senior naval officer closed his folder. "We will assume official care transfer from this point," he said. "Lieutenant Commander Hale remains under medical supervision here." He looked at Emma. "Your documentation prevented an unauthorized extraction." It was not praise. It was fact. Emma nodded once. "Security logs confirmed the override. And you restricted access to the chart," he added. "Yes." He studied her for a moment. "Stay assigned to this bay." It was a request. Professional. Controlled. Dr. Keller shifted uncomfortably. "She's probationary," he began. The naval officer's gaze moved to him. "She stays." No raised voice, no debate. Emma felt the tremor return to her hands briefly. Not fear. Release. She steadied them against the bed rail. "I'll continue monitoring," she said. The commander's voice was low now, almost private. "You didn't just see me," he said. Emma met his gaze. "You saw the pattern." She did not respond, because that was the truth. He had pretended. She had detected. But more than that, she had recognized the structure around it. Unauthorized access. Isolation attempt. False authority. He shifted slightly, wincing faintly at the movement. "Hayes," he said again. "Yes." "What unit trained you to read reflections before faces?" The question hung between them. She did not answer directly. "Hospital lighting does the rest," she said quietly. A corner of his mouth moved. Understood. No further probing. The naval officer cleared his throat. "We'll conduct formal statements once stabilized." Emma nodded. Marisol stepped closer, relief visible in her posture. "You were right," she whispered. Emma did not absorb the validation. She checked the monitor again. 72. 14 respirations. Stable. The crisis had ended without gunfire, without shouting, without spectacle, just documentation, just timing, just one refusal to step into a hallway alone. The commander's eyes softened for a fraction of a second, gratitude held in check by discipline. "You didn't just see me," his gaze seemed to say. "You saw the danger before it formed." Emma stepped back into her role. Junior nurse, probationary badge, voice low, hands steady. No spotlight, just the work. And the truth, spoken in a quiet voice, had been enough. Dawn did not arrive dramatically. It filtered in through the ambulance bay glass in a pale grey wash, softening the fluorescent glare that had ruled the night. The ER looked smaller in morning light, tired, monitors still pulsed, IV pumps still hummed, but the edge had gone out of the air. The story, however, had not. Whispers moved faster than charts. Federal agents. Unauthorized extraction. He woke up. Emma heard the fragments as she moved between bays, checking vitals, updating notes, adjusting a blanket for a patient who had slept through most of it. She did not join the clusters forming near the nurse's station. She did not correct details, she charted. Her write-up for the night was precise, factual, stripped of interpretation. Override badge logged at 01:59. Transfer attempt without documented chain of custody. Access restricted pending verification. No adjectives, no self-reference. Administration arrived just after shift change. 2 suits, controlled expressions, damage assessment in their eyes. The hospital director stepped into Trauma 2 and surveyed the space as if it were a courtroom. "Unfortunate situation," he said quietly. No one answered. He approached Emma as she removed a used IV line from a tray. "Your probationary note from earlier," he began carefully, "about challenging a physician's order." Emma paused. "Yes, we can reframe that." She met his gaze calmly. "Reframe? Miscommunication under stress," he clarified. "No need for permanent documentation. Not apology. Optics." She nodded once. "As you see fit." He studied her. "You understand why that's helpful?" "Yes." She did not thank him. He moved on. In Trauma 2, the commander was prepared for official transfer, not rushed, not secretive, proper paperwork, proper signatures, verified chain of custody. He lay propped slightly upright now, pale but alert. No dramatics, no ceremony. The naval medical officer stood at the foot of the bed reviewing final notes. Emma approached to check the IV one last time. "Pressure stable," she said. "Transport within safe window." The commander looked at her. Understood. No public acknowledgement, no overt gratitude, just professional closure. As the gurney began to roll, he spoke once more, low enough that only she heard. "Door reflection," he said. She inclined her head slightly. "Always." That was all. He did not reach for her hand, did not ask for contact, did not reveal her past. He was wheeled through the trauma doors and out into controlled daylight, surrounded by correct authority this time. The room felt ordinary again, almost. At the nurse's station, a small folded note rested near Emma's keyboard. No envelope, no signature, just a single line in precise handwriting. "Your judgment prevented casualties." She read it once, then placed it inside her locker without comment. Charge Nurse Benton approached quietly. No clipboard this time. "I should have listened sooner," Benton said. Emma did not look up immediately. "Verification matters," she replied. Benton nodded. "The door you closed earlier, we found 2 more propped in radiology." Emma absorbed that. "Secure them." "We will." A pause. "You handled yourself well." It was not warm, it was not sentimental, it was respect. Emma gave a small nod. "Thank you." Her shift officially ended at 7 a.m. She signed out electronically, removed her badge from the scanner. The probationary tag still hung beneath her name. Unchanged. She walked the unit once more before leaving. Crash cart seal intact, trauma corridor door closed, no paper wedged into frames. She adjusted one oxygen line in Bay 3, tightened a loose bed brake, then stepped toward the exit. Rain had softened to mist. Morning light flattened the city into quiet grey. The parking lot shimmered faintly. She stepped outside without looking back. No one followed her. No cameras. No applause. Just wet asphalt and distant traffic beginning its day. Her hands no longer trembled. But the memory of the night settled into the place she kept things she could not say. A man who pretended to be unresponsive. A corridor override. A false authority exposed by timing, not force. She inhaled the cool air. Discipline under pressure. Read the room, read the body, protect the space. She walked toward her car, ordinary in every visible way. Badge in her pocket. Rain collecting at the edges of her sleeves. Still anonymous, still choosing the quiet. Because sometimes the difference between extraction and protection is not a weapon. It is one nurse who refuses to step into the hallway alone.